Specialist presents Medicare supplements versus Medicare Advantage plans. So we're getting into the busiest time of year, specifically for Medicare Advantage and Part D. But keep in mind, guys, the number one time of year that Medicare supplements are written is during AEP. So AEP is just, I just call it enrollment period. Enrollment for supplements and enrollment for Advantage plans too. So we're about to get into answering a ton of questions about Med Subs versus Medicare Advantage plans. Also keep in mind, again, Medicare supplements, AEP, even though that is the number one time where Med Subs are written, Medicare supplements are not guarantee issue during AEP unless somebody's, within their open enrollment or they're within some GI situation. But AEP is not just innately guarantee issue for Medicare supplements. So those individuals do have to go through medical underwriting to qualify for those plans. So just keep that in mind.
Absolutely. It is a time of year that people, all of your clients are coming into your office. Hopefully you're still talking. Hopefully you're still touching base with your Medicare supplement clients. So
yeah, and getting a lot of really great people saying just wanting to review, trying to see, get new or fresh perspective. So that's exactly what this is for. You're at the right place. So these are basically a lot of people, whenever they're wanting to know MedSup versus Medicare Advantage, these are the top questions that we get. These are the questions that we're going to address today. Do you really need to offer both MedSup and Medicare Advantage? I'm hearing that a ton right now, especially going into the compliance updates that go into 10.1. A lot of people are abandoning ship on certain products. So do you really need to offer both? What's the better option for my clients? Really, we know that there are different plans, different options. Which one should I try to push my clients towards? And last but not least, what's good for me as the agent? What should I make sure that, at the end of the day, you got to keep your lights on. Which one's a more profitable venture for you? Absolutely. So we're going to cover up these questions. First one being, should I offer both? That's a pretty fair question and has definitely changed since I've been in the industry in 2013. We're seeing a huge shift in this question.
For sure, especially with some of these cool new benefits that we're seeing roll out in the past couple of years that we'll kind of talk about here in a bit. Some of the lines between, some of those hard lines between, well, this would be better for MedSup or this would be better for Medicare Advantage. Some of those lines are getting blurred because of benefits that are changing on the Medicare Advantage side. So now really more than ever, it's a really valid question if offering both is worth your client's time and worth your time. So we want to make sure that we address that today.
And honestly, the answer is yes. Should you offer both? Yes. Because that's what it, and again, it used to be if they make this much money, they go here. If they're low income, they go here. It's basically what I always talk about when I do my Medicare 101 trainings is Medicare supplements are not better or worse than Medicare Advantage plans. And I know agents have their opinions. It's really important whenever you are communicating with your consumers that you don't just say Medicare supplements are better or Medicare Advantage plans are better. It has to do with what is more important to your clients. You know what I mean? It has more to do with what do your clients value versus anything else. So Medicare supplements are not more important or not better than Medicare Advantage plans and vice versa. I will say that the market is shifting pretty dramatically to, it used to be that 34% of beneficiaries had a Medicare Advantage plan, 26% had a Medicare supplement. You are seeing a swing in that. Recent studies are showing as many as 42 or 46% of Medicare beneficiaries currently have a Medicare Advantage plan. And, there's reasons for that. A lot of people, we go about why have people swung to the Medicare Advantage plans. I think one of them is that some of them can be misleading. We talk about the don't name it ads, all the advertising. A lot of people don't really truly understand what they're getting on a Medicare Advantage plan. So a lot of people are swinging that way. It's also a lot because people are really comfortable with Medicare Advantage plans due to higher education about them and wider availability on them. So there are true legit reasons why Medicare Advantage plans have gone up as far as population goes that aren't just people are getting tricked into them. So again, you absolutely need to offer both. It's really important to, again, I mentioned it earlier, not to talk down on an option because people will buy it. Even if you aren't selling it, people will buy it. And so if you're saying, hey, these Medicare Advantage plans are terrible, you never know what you're going to get, don't buy them. If they are going to buy them, which studies are showing they're more likely to, they're just not going to buy it from you.
Absolutely.
So just making sure that you're not talking negatively about one or the other.
And at the end of the day, whenever someone walks through your doors, you want to be able to offer them, anyone who walks through your doors, you want to be able to offer them a solution that is custom for them. You don't want to just treat everybody the same, because there's no one size fits all.
Exactly.
So obviously the way that Medicare Advantage plans and the way that Medicare supplements, they're going to serve different people for different reasons. And so you don't ever want to have a business where you're claiming to be able to advise people and help them really customize their benefits, and then not be able to actually do that just because you might not want to work with one product or another.
Well, imagine being like a grocery store and being like, oh, I like fruits, I don't like vegetables, so I'm only going to offer fruits, I'm not going to offer vegetables. Well, no, people are going to go to grocery stores that are all encompassing. They're not going to go to a fruit place here and a vegetable place there. The way that you run your business needs to be done the same way.
Exactly.
So then you have to ask the question, okay, so I know I need to offer both, I need to make both available, but like, I do understand it's my job to advise my clients what's a good option for them, you know what I mean? So how do I determine what is the better option for my client? How do I help my client determine, should you go the MedSup route, or is maybe a Medicare Advantage plan a great option for you? Sadie said it perfectly earlier, there is no blanket statement. We used to say, if your client looks like this, they go on a MedSup. If your client looks like this, they go on a Medicare Advantage plan. And I think, Sadie, you said it perfectly earlier, those lines are so blurred that there are no more blanket if this, then this statements.
Correct.
So let's go ahead and break down. Yes, and Nicholas makes a really great point. He says that this economy is a big reason that a lot of people reason MAPD over Medigap. And you know what I mean? We work with one of the co-hosts of Medicare Cafe. Her client base is typically high income earners. She gets a lot of referrals from her partners, and she said like a lot of people are going from MedSup to MA because of the Part B increases, the inflation on everything. Well, let's talk about that here for a little bit. So how can you tell what is a good Medicare supplement client? What are the values, or what are the advantages of having a Medicare supplement that may make a client look at being like, that might be a really good option for me?
Yes, absolutely. And before we even dive into that, just kind of going over some of those reputations, like you said, some of those wealthier clients, that used to be the reputation of Medigap is, oh, well, people who are a little bit wealthier, or people just assume they can't afford a Medicare supplement or something like that. We're seeing those lines change a little bit, change in perspective there. And then also, it used to be, well, whenever I turn 65, I'm just going to go ahead and go right onto a Medicare supplement, so that way I can jump into a Medicare, there's flexibility there. A little more flexibility there.
Well, it used to be like the rules were, if you can afford a MedSup, go MedSup. If you can't afford a MedSup, go Medicare Advantage. That is so not the case anymore.
Exactly. Yes, absolutely. So some things that are staying the same, I say that, but the first one is actually going to be a little bit of an exception. We used to say Medicare supplements might be really great for people who like to travel often. Now, I've already seen a note about this in here. Let's see, Stacy said something bringing up the national networks. We'll talk about that a little bit more whenever we go over Medicare Advantage. But the reason why I left this on here was because this is a very good example of how those lines are being blurred. It used to be, if they want to travel, Medicare supplements don't have that network. They have a national network, or they have anywhere that original Medicare is accepted, which is almost every provider, nearly every provider, a Medicare supplement person can go. So if they have grandchildren in New York and grandchildren in California, they don't have to worry about, they'll have that Medicare supplement coverage everywhere in between. Now, that's being changed a little bit with national networks from Medicare Advantage plans. So we'll talk about that here in just a little bit, but really great example of something that used to be, but is kind of starting to be a little less of a reason to go with Medicare supplement, if that's just one factor that you're looking at.
The next one, kind of working on the same thing, living in rural areas. The reason why we mention rural areas is because they have less access to health care compared to those who live in cities or even small or larger towns. They typically, have to go to a certain provider. They don't have choices just because of the availability. So MedSup being the reason that Medicare supplements do not have networks that they have to deal with, rural areas tend to work better with them anyways, just because they don't have the option, so they don't want to even limit their options even more, having to deal with a network.
Absolutely.
We also say Med-Sup clients, this really hasn't changed at all. Visits or clients who visit the doctor often, your high utilization clients tend to do well with the Medicare supplement. They have less copay, they're just less involved with the billing.
Correct.
You know, depending on they have an F, a G, or an N, you know, they are not going to receive a bill from the provider nearly as often as they would if they're on a Medicare Advantage plan, which comes with copays, deductibles, things like that. So you also, again, want that freedom to be able to see your specialist. You know, we know most Medicare Advantage plans will say, if you see a specialist, you need a referral from your primary.
Right.
Medicare supplements don't follow that same rule. So being able to continue to see their specialists when they want to see, not having to be as involved in the billing nearly as often,
Absolutely.
you know, that's a significant reason. I would say Medicare supplement clients are those who just like the ease of usability. Just do not want to be involved in that billing process. That's going to be your Med-Sup clients. And then Stacy brought this up a little bit ago, talking about they don't like change. Medicare supplement plans do not have to be shopped on an annual basis.
Right.
You know, typically you'll see Medicare supplements. The top reason why people change Medicare supplements is for a lower premium. But keep in mind, Deaf research has found that people actually don't even start thinking about shopping Medicare supplements until their premium has gone up by $25.
Yeah.
Which again can take several years to do.
Right.
So if somebody who's like, I don't enjoy shopping Medicare supplements, I'm okay to pay a little extra for a little extra stability, tend to be, you know, people who value Medicare supplements. This is a little different than it was. Medicare Advantage plans used to have like a lifespan of 2 to 3 years on average. We're starting to see Medicare Advantage plans really stabilize, so that lifespan's going up 5-6 years. So those are kind of competing with each other right now, but it's still like the idea that this could change. This you know, this Medicare Advantage plan could look completely different next year compared to Med-Sup, which doesn't change.
Exactly, yes. And like you said, I'm just reiterating, there are those people out there who are willing to pay more, so that way they don't have to worry about what their coverage is going to look like in years to come. They just want to get on a plan and stay with it for as long as they can afford it. You're going to have people, and that's one thing that's still staying very true to Medicare supplements, because obviously you're still, no matter what, you're going to have to change Medicare Advantage plans or review it at least, because there's going to be changes year after year after year. So that is one thing that definitely stands true for Medicare supplements.
So keep in mind, if they're on a Medicare supplement, that means that they're on a Medicare or a Part D plan, and that Part D plan does have to be reviewed year to year, and can and usually will change year to year. So it just is less shopping on an annual basis, but it doesn't completely eliminate the shopping on an annual basis.
Absolutely.
So again, just to reiterate, your Med-Sup clients are going to be, or your Med-Sup clients may look higher utilization. They're sick, they're going to the doctor often. They may be your RVers, your travelers, grandkids in New York and California, people who don't want to have to mess or even have to research networks. And they're going to be people who, again, want to stay out of the weeds when it comes to their medical billing, want to know, I pay this monthly premium, I don't have to worry about much more than that.
Yes.
So let's jump into your Medicare Advantage clients. Again, this is what's really changing. It used to be, who were your Medicare Advantage clients? It was people who couldn't afford a Med-Sup premium. So they were willing to, you know, say, what we used to say is, you're willing to save a lot of money up front and pay for it on the back end. I think that's fair to say. Med-Sup is high premium, low risk. Medicare Advantage plan is low premium, higher risk. However, that risk factor year after year after year has been decreasing to you know, really a manageable risk in the mind of a lot of people.
Absolutely.
So Medicare Advantage plans tend to be really great for individuals who do live in a higher populated area. The reason for that is that if you are in an area that is more densely populated, it's much more likely that your Medicare Advantage plan benefits are going to be really, really rich.
Yes.
The reason for that is that CMS determines how much money to allot to a Medicare Advantage plan based on the population there. So your denser your population, the more money that plan gets from CMS. That's why, again, why Med-Sups tend to be better for those in rural areas, because they're really great for those in denser populations. We also say Medicare Advantage plans are great for individuals who don't see the doctor as often. A really great rule of thumb is to say a Medicare Advantage plans are great for people who are healthy and want to stay healthy because they have the gym memberships, the over-the-counter benefits. They have all those really great bells and whistles to keep someone healthy. But if somebody does have to utilize the plan, then it gets a little sticky. Then you have the co-pays, the deductibles, you have the co-insurances, things like that.
Absolutely.
Compared to a Medicare supplement that you're going to, you know, if you're sick, if you're healthy, it doesn't come with gym memberships. It doesn't come with the bells and whistles. But if you're actually going to use the plan for the intended purpose, it's easier, can save you money in the long run.
Absolutely. And I think that's a good point going into the Medicaid eligible. We know that you can't sell a Medicare supplement to someone who is full Medicaid. So if you have someone walk through your door that is DSNP eligible, having Medicare Advantage on your portfolio is something that's going to be obviously their best option for them. Also going to be really awesome for veterans, but I'm jumping to the next one. But no, Medicaid eligible.
Same idea. Those two work the same.
Exactly. So one reason why they might want to is what you were just talking about. They have those extra bells and whistles. They're getting their health bills paid somewhere else. They're having extra support somewhere else, but these Medicare Advantage plans allow them to be able to take advantage of those extra bells and whistles, those extra benefits that come with having Medicare Advantage plans.
And again, you said it perfectly. That's why they get the plans. Right. They don't need it because they're getting their care elsewhere, but they want all the really cool things to keep them healthy.
Exactly.
Stacy brought up a really great question. She's like, I would think that more people would want a Medicare Advantage plan who are unhealthy because there are no health qualifications. So that's a great point. Medicare Advantage plans have zero health underwriting. So you do see that, Stacy, but I'm saying the plan of choice. If they're in their open enrollment or guarantee issue plan, if they're going to be high utilization, if they can get a Medicare supplement, that's typically the route they choose to go. But if there is no other option other than just having original Medicare, then yes, the Medicare Advantage route. And in this case, I'll say Medicare Advantage route is better than original Medicare. But if they're high utilization, they tend to go med sup if they can qualify for it or get it in a GI situation.
Absolutely. Really great point, though.
Yeah, and that's what Nicholas mentioned. One of the biggest reasons people choose a Medicare supplement is because of ongoing medical issues. Again, if you're high utilization, you want the option to see your specialist when you want to see them. You want the option to go to any doctor that you want to.
Right.
Med sups tend to be the route to go.
Absolutely.
If you're going to use, this sounds really silly, and this is a poor statement to make because it's a blanket statement, and blanket statements do not exist here. But if I were to try to cultivate one, it'd be like, if you're going to use health insurance for the health insurance, your med sup is what you're wanting to do.
Yeah.
If you're wanting to have your health insurance cover, but you want to get like a bunch of extra stuff to keep you healthy, Medicare Advantage plan is the route to go.
Yeah.
So that's just a kind of a really simplified version of saying what's, and again, like, you need to talk to your consumers to figure out what's important to them. Income has little to nothing to do with it anymore. Where they live has little to nothing to do with it anymore. It's truly, do you value the bells and whistles and doing all the extracurricular, or do you value the healthcare side of things? And the answer may surprise you depending on the client.
Yeah, I think it's safe to say that the best way that you're going to learn to be able to choose that is knowing what questions to ask people to get that answer, because every person's going to look different. So if you are able to ask the right questions, you're going to be able to finally figure out which one's going to be better.
Exactly.
Yeah.
Yep. And that's done in the fact-finding process.
Yes.
Now, we've mentioned this a couple of times, asking about national networks. Again, it used to be that if you did any amount of traveling, go med sup. Even if you go on a vacation once a year, go med sup. National networks is something that's actually come into the fold about 3 years ago, but it was really, really limited. You're seeing a huge amount of companies, your big boys, your United Healthcare, Humana, Anthems, who are offering what they call national networks, meaning that if you, let's just say United Healthcare, their national networks are available on almost all of their plans. If I live in Missouri, which I do, that's not an if, that's a real thing. I live in Missouri, but I'm traveling to Florida on a regular basis. Then I can just, if I go to Florida and something happens, or I just, have a cold, I want to see a doctor, as long as that provider accepts United Healthcare, even though like my plan and my providers are in Boone County, Missouri, if I go to Florida and they accept United Healthcare, then I can use them as a provider. National providers means any provider that accepts that company as a whole has to accept your plan now. So that really does open up, because like, again, you use those big names like United Healthcare, Humana, Anthem, you can find providers that accept those plans anywhere.
Right.
So it really does open up. You still have to do some checking to say, does this provider accept this company. So there is still some checking required, but you don't have to be afraid as much about access to care, because you will find somebody who accepts that in that, in that location.
Absolutely. And you never know. I don't want to predict the future or anything, but you see these benefits a lot of times getting better and better and better.
Mm-hmm.
You never know where we'll be at from, in a
Yes.
couple of years from now. National
Mm-hmm.
networks might just be the norm. It might just be the default on Medicare Advantage plans. So that's something that you definitely need to be keeping an eye on. And of course, we're keeping an eye on it, because we even saw a big jump in last year. It almost seemed like they were kind of, some of the bigger name companies were kind of dipping their toe into that. And now you see it a lot more widespread. So it's something that people are definitely catching on to.
Yes, yes, yes. A question that we have is Part C plans accepted by any provider that accepts Medicare. So when it comes to traditional Medicare Advantage plans, they go by networks of doctor. And so you could have a doctor that accepts Medicare but does not accept that Medicare Advantage plan, which is very common. We have several major hospitals here in Columbia, Missouri that don't accept certain Medicare Advantage plans. So that's again a really big concern about why, understanding if networks and ability to see your specialist is good for your client, that's going to help you go MedSup or Medicare Advantage. What we're saying with these national networks is saying that basically it used to be that, like, for example, a hospital could accept United Healthcare, but they didn't accept this United Healthcare plan.
Right.
National networks that some carriers are offering are now saying, oh, you have United Healthcare. I don't care what plan it is. We accept United Healthcare. We'll work with that plan. That's what a national network means. Oh, yeah, and Stacy was talking about access to Mayo clinics is a huge pro for Medicare Advantage prescription drug plans. Always double check the Mayo Clinic. Some of them will accept, some of them won't. So always double check that Mayo Clinic. It's a huge pro for like a G versus an N, because Mayo Clinics oftentimes don't accept assignment. Interesting to know. So anyways, and I have seen several comments here about these Joe Namath ads being incredibly inaccurate, and these Joe Namath ads being really, lying to consumers. I want to keep in mind, and again, I hear you guys, and I understand there's a reason why complaints to Medicare went up over 250% this year over last year, and I think a lot of that is these Joe Namath ads. Yeah. But keep in mind, I want to make sure when we're complaining about Joe Namath ads that we understand what we're complaining about. The Joe Namath ads are not an enrollment center. They are not an agency themselves. It's a lead generating source. Now, lead generating sources are typically being sold to telephonic centers and things like that, call centers. But this advertising itself is not designed to educate. It's actually done some pretty cool things for our industry. I was talking to an agent the other day, and he's talking about it's making Medicare sexy again. You know what I mean? It's making Medicare a topic worth having because everybody's talking about it. You're hearing it on the TV all day long, which is really great for your business. The more people are talking about Medicare, the more you need to capitalize on that opportunity. So yes, the Joe Namath ads have really affected the population by being misleading and by directing people to call center agents, which obviously we know don't always have your consumers' best interests in mind. There's a lot that you can be doing in your advertising and your marketing to take advantage of the fact that Medicare has become a really, really popular conversation.
Absolutely. Yeah.
So just keeping that in mind, just knowing that, again, those Joe Namath ads, though they can have proven to be harmful, why we've seen the huge increases of complaints to Medicare, there's a lot of our really successful agents that we're seeing doing are taking screenshots of the Joe Namath ads and saying, like, make sure that you come talk to your local agent about that. It's now more important than ever to have these conversations with your local agent. Absolutely. Okay. So the last question that we want to answer, and Nicholas is saying that the ads are can be extremely hurtful and extremely negative. I 100% understand. Sure, they are very misleading, but there's a lot of opportunity that a local agent can make out of those advertisements as well. There's always opportunity. Anytime that there is any type of conflict or any type of negative things happening, negativity is followed by opportunity, always. Yeah. So the last thing is, which one's better for my agency? The thing that we always have to talk about here, which one's being better for the agency, is talking really about profitability. And profitability is basically, what are you expending, what are you making, and do you come out on top or not?
Right. Or like, what's even worth my time, which is going to come down to finances. But what is worth my time? What is worth my client's time? at the end of the day, that's what's going to make me the most money. That's what people are really asking.
Yes, 100%.
Which it makes sense that you are. I think that's very fair. It's your job. You're not doing this for free.
No, and your time is worth something. So number one, let's look at Medicare supplements. We know the lifespan of a Medicare supplement is roughly around 7 years. Like I said, it takes somebody about an increase of $25 to their premium to start shopping meds at premiums. So we do know that they're really, really stable. They don't change. They don't get shopped often. And we also know that those commissions, most of the commissions that are paid on Medicare supplement are the same years 1 through 6 or 1 through 7. So, so again, you are receiving a lower commission compared to Medicare Advantage plans, but they stay on the books longer, and you get the same commission for the entire lifespan typically of that product. We also know that they require a lot less hand-holding. You don't have to, because the consumer is much less involved in the billing, so they don't take as much servicing. You don't have to shop them nearly as often, and they don't take again, you don't have to handle the claims like you do on a Medicare Advantage plan. So less work from the agent's perspective, lower commission, but the commission stands out for a longer amount of time. Compared to Medicare Advantage plans, with the lifespan right now is about 4.5 years of a Medicare Advantage plan. They do pay lifetime of those commissions. They don't die out like med subs after year 7, but they do have dramatic cuts after year 2 of that person owning a Medicare Advantage policy. And again, the premium or the commissions are much higher, but they require a lot more service work. You know, you're much more involved in that, and the commission, or excuse me, you're much more involved in the servicing of it. You have a lot more utilization, so you have a lot more questions on it, and you have to work on your retention a little bit more, because people, as we see, tend to shop and switch those much more often. So both require annual appointments, both require year-round maintenance. Ultimately, it kind of comes out in the wash.
Yeah, kind of ends up equaling out, especially over the long term.
Yes, yes. Yes, absolutely. And James said having commissions or having trail commissions, basically renewals, is a must for an agency's financial health. Very important, especially for older agents. 100%. That's something I'm making sure that you have renewals to fall back on. And you know, that's what's so cool about this industry, is that you get paid to take care of the people that you love.
Yes.
And that's what's so cool. So I know a lot of people look at commissions. I work with a lot of people who look at the business as purely financial. And they say, well, I'm only going to do Medicare Advantage plans. I make so much more money on Medicare Advantage than med subs. But it's like, but you have to understand you're going to spend more time on a Medicare Advantage plan. Right. You have to shop a Medicare Advantage plan. They're less stable. They're much more likely to shop with other agents compared to the Medicare supplement. So it truly does come out in the wash. Medicare supplements and Medicare Advantage plans are about the same profitability.
Absolutely.
On paper, it may look like one makes more than the other, but as far as profitability is concerned, they come out pretty equally. So, all right, guys, that is our Medicare supplement versus Medicare Advantage plans. We try to keep these trainings down to less than 30 minutes, but I do want to keep some time open. We've had so much communication today. I do want to I'm going to stop recording